As we told you earlier, the largest union of registered nurses, National Nurses United, is calling on the CDC to reinstate its COVID guidance and recommendations that everyone wear a mask in public or in close proximity to others outside of their own home.
The president of that union, Jean Ross, joins us now to discuss why they're making that request. First of all, thank you for being here, Jean. And I want to say thank you really to all of the nurses out there, because I know you put yourselves in harm's way during this pandemic, and we are so grateful. Obviously, you want to protect yourself, but I'm curious now, with so many people vaccinated, why the recommendation for everyone to wear masks?
Well, I think what we had feared might happen when the CDC in May said it was fine for people who were fully vaccinated to not worry about crowds and distancing and masking. What we feared would happen seems to be happening, especially with the mutation, the Delta variant being the dominant one in this country right now. So in our efforts to protect the public and of course ourselves as registered nurses when working and other essential workers, our recommendation was please don't open too soon, which most states did. And please keep masks in place. It's too soon. So what we're finding right now is that indeed the Delta variant is spreading. And indeed, even if you're fully vaccinated, you could possibly, with aerosolized transmission, give it to somebody else who hasn't been vaccinated. So or can't be vaccinated.
So Jean, but if we look at the numbers, in Illinois, we've got just under 6 million people fully vaccinated. Of those, just 518 have been hospitalized with COVID-related illness. So that's 0.009%. And there have been 141 deaths among people who are fully vaccinated, which is about 2% of Illinois' COVID-related deaths since January. So if the vaccines are working so well, why should vaccinated people have to mask up again when it's people who are choosing not to get the vaccine for a host of reasons that are most at risk?
Because we care about all people, even those that are unvaccinated. And just as masks were explained in the very beginning as some protection for you, but basically to protect others from you, it still is. And since, what is it, less than 48% of us are fully vaccinated in this country, which is a shame. I know that we're still working on that. But because that is true, we have to continue to protect those people. We also have to continue to protect not just those who choose not to vaccinate, but those who cannot, or who were vaccinated, but their immune systems are so affected by whatever disorder they have, their immune system can't fully ramp up to be immune to the virus. So we still do care about all those people. People are still dying. We had an increase of 16%, I believe, in the previous week. Over 40 states, let's see, I have seen an increase in daily new cases. That's not good. That's when you start worrying about a surge. And nurses, it's not been long enough for us to not remember exactly how bad things can get. And so we're asking for our sake, for the public's sake, for the safety of our patients, to please use that masking, because it will help save lives.
So I'm curious, we had a story on earlier about hospitals and institutions requiring vaccinations. How do the nurses feel about that?
Well, you know, we have always said, I don't believe in forcing people to do things that they don't want to do, but most of our nurses do choose to get vaccinated. Some of them, of course, are just like the general public. There are reasons they can't. But I think that it's important to vaccinate, but that's only one key part. Keep in mind what we did when we were waiting for the vaccines to come into being. It's a very small thing to do, but it has a huge impact.
Okay, Jean Ross.
And it's cost effective.
Thank you for the work you do and all the nurses who have helped us all so much in the last 16 months. Thanks for joining us.
You're welcome.